everyone, and welcome back to Nursing Research Tips. I'm your host, Jenny Barrow, and if you're tuning in for the first time, this is your go-to show for breaking down nursing research and evidence-based practice into practical, real-world tips that you can use. I'm so glad you're here with me today. Today, we're tackling one of the most fundamental and sometimes the most frustrating parts of evidence-based practice: asking a good question. More specifically, we're diving into where EBP questions come from, the difference between background and foreground questions, and how to build strong clinical questions using PICO or PO formatting. We're going to also touch on some common mistakes and how to avoid them. So let's jump right in. So let's start with something super basic, but often overlooked. Where do EBP questions actually come from? Often, they arise from what you see and experience in daily practice. Maybe you notice inconsistencies in how your coworkers manage wound care. Maybe your patients aren't getting the outcomes that you would expect despite following protocols. Or maybe there's a new product or a new policy, and people are unsure whether it's better, worse, or just different. In other words, EBP questions come from you. They come from your coworkers, from the unit you work on, from those head-scratching moments where you wonder, why do we even do it this way? Or, is there a better way to do this? Evidence-based practice starts with curiosity. For example, let's say on your medical surgical floor, nurses are using different strategies to prevent pressure injuries. Some prefer foam dressings, others rely on barrier creams. But which one actually reduces pressure injury rates? That's a perfect EBP question waiting to happen. These questions don't have to be dramatic or earth-shattering. They just need to be practical and aimed at improving patient care. Here's where things get tricky for a lot of people. Not every question is an evidence-based practice question. So let's talk about the differences between background and foreground questions. Background questions ask about general knowledge. Things like, what is delirium? Or how does insulin work in the body? Those are foundational and important, but they're not the focus of evidence-based practice. You can usually find these answers in resources like textbooks or trusted reference tools like UpToDate or nursing drug guides. On the other hand, foreground questions guide clinical decision-making. They're specific, patient-centered, and actionable. For instance, instead of asking the background question, what is hypertension, a foreground question might be, in adults with newly diagnosed hypertension, is a DASH diet more effective than medication alone at lowering blood pressures? So you see the difference? Foreground questions are the ones that drive evidence-based practice. They ask what works best, for whom, and in what context. And knowing whether your question is background or foreground will save you time, it will clarify your search strategy, and it makes your project far more meaningful. Okay, so once you know that your question is indeed a foreground question, it's time to shape it using a structured format. That's where PICO and PIO come in. PICO, PICO, stands for population or patient problem. The I stands for intervention or issue. C stands for comparison. And O stands for the outcome that you're most interested in. So here's a classic example. In elderly inpatients, does the use of foam dressings compared to barrier creams reduce pressure injury rates? So if you are following along, we can tell that our P, or our population, is elderly inpatients. That's who we're interested in learning more about. Our I, or intervention, would be foam dressings. We do have a C, a comparison, which in this case was barrier creams. And our O, our outcome, was pressure injury rates. PIO, on the other hand, skips the comparison. It's great to use a PO question if you are asking a question that explores experiences, or if your question does not involve comparing one intervention against another intervention. Here's an example of a PO question. In family caregivers of people with dementia, that's our population, how does music therapy intervention affect caregiver stress outcome? The choice between PICO and PO depends on the question you're asking, but both are tools to help you clarify what you're really trying to find out. Now, let's be honest, crafting a solid clinical question isn't always as straightforward as it sounds. One common pitfall that I often see, especially with students, is writing a question that's either too vague or too broad. For example, instead of asking, what helps prevent falls in hospitals? A better question might be, in hospitalized older adults, how does hourly rounding compared to usual care affect fall rates during hospitalization? That's a nice, focused PICO question. Another mistake, mixing up the I and the C, the intervention and the comparison. Remember, your intervention is what you are curious about applying in practice, and the comparison is what you're weighing it against, whether that's usual care, some other intervention, or possibly no intervention at all. Now let's expand our lens just a bit. Did you know that you could also add a T for time at the end of a PICO question? That makes it a PICOT. This can be especially helpful when you are considering how quickly an intervention shows an effect. For example, you might ask, in patients recovering from total knee replacement, how does physical therapy started within 24 hours compared to therapy started after 72 hours affect mobility within the first week post-operatively? That T, or time, helps to bring in a real-world sense of urgency or feasibility. Another note, not all EBP questions are strictly quantitative. Some are more qualitative in nature, especially when we're interested in experiences, perceptions, or barriers. You might use a modified framework or just simply reframe the question. For example, in nurses working night shifts, what are the perceived barriers to implementing hourly rounding protocols? That kind of question can still guide practice by helping teams understand challenges on the ground. We're typically not going to use the formal PICO question format for qualitative questions because qualitative questions don't usually include interventions or comparisons. The bottom line, whether your question is quantitative, qualitative, or mixed, the key is clarity and clinical relevance. Make sure it's tied to a real world issue that can lead to meaningful change. Writing a strong question takes practice. So here are a few helpful tips for you. First, it's important to be specific and measurable. Next, base your question on real world observations or clinical challenges that matter to you and your patients. 3, don't be afraid to revise your question several times. Also, ask yourself, could this question help guide a decision at the bedside? And for a pro tip, collaborate. Bounce your question off of a colleague, a faculty mentor, or a librarian. A fresh set of eyes can make all the difference in the world. All right, that's a wrap on today's somewhat brief episode. Hopefully, you're walking away with a clearer understanding of where EBP questions come from, the difference between background and foreground questions, and how to format that question using a PICO or PIO format. Your challenge for this week, I want you to think back to a clinical moment that had you scratching your head. Try turning that moment into both a PICO and a PO question. Compare them. What do you notice? And don't forget, next week we're diving into search strategies for EBP questions. How do you go from a well-written question to finding the actual evidence? We're going to talk about databases, filters, and some search hacks. Thanks for joining me on Nursing Research Tips. I hope to see you next time.